Hey everybody, this is Dr. Kyle with Ice Clinics bringing you your next tip for Tuesday. So anyone that is a regular patient here knows that we like to take the angle of being very educational and also very empowering with our patients. That's kind of the idea behind our tip today. Headaches are things that we see very regularly here in the clinic. We get lots of discussion around, and we have people trying to figure out the source of why they're getting their headaches or why they're so intense or why they're so frequent, those kind of things. So what I want to teach you guys today is just give you a few tools to maybe better assess why you're having your headaches, and that way it can maybe drive you towards more of what would be a most effective treatment for you, and then obviously avoiding them more in the future. So we'll go over kind of the three types of typical headaches that we see within our clinic. Probably the most common type that we hear about are referred to tension headaches. Tension headaches are typically a bilateral presentation, meaning they usually end up in this neck of the woods. And as many of you can probably figure out with tension, so like grinding your jaw, clenching your jaw, shrugging your neck up into your head, into your skull, a lot of that can manifest in tightness that kind of builds up around the jaw and into what are called our temporalis muscles on the side of our skull. That's probably one of the more common ones that we would notice, especially when people are experiencing stress or things like that. Probably the next most common one that we would see are what are referred to as cervicogenic headaches. It's kind of a fancy word, but just think that cervicogenic essentially means that it's coming from the neck. So those headaches, I find from my perspective, can be all over the place. They can present on one side, they can present on the top of the head, maybe around the sinuses, maybe in the back of the head. They're building up from one side of the neck into the shoulder. They can kind of be all over the place, but they typically don't have a consistent pattern or presentation for the most part. And like I said, cervicogenic, meaning they kind of come from dysfunction going on within the neck. That can be either the joints or the muscles, tendons, ligaments, those kind of things. Two more types of headaches that we see pretty regularly, maybe not quite as often. Everyone's probably heard of a migraine. So migraine presentations have a kind of a wide spectrum of how they can affect people. In most cases, I would consider migraines are typically more severe, where you're kind of down and out. You want to lie on the ground, you want to dim the lights, maybe you feel sick to your stomach. Those are more classic presentations of a typical migraine. A lot of people will experience them maybe right above an eyeball or deep within an eyeball. And you usually feel like you want to press your head in some way just to kind of take pressure off. But those can typically be more of the severe headaches that people would experience. And then I would say the last ones that we see in here regularly are sinus headaches. And those ones are pretty typically, you'll feel right here just above the brow, maybe off to the side of the nose, and then what are called kind of the maxillary area right here. And those would be more symptoms you'd associate with sicknesses, maybe you're congested or you just feel like you have a lot of sinus pressure going on. Those more than likely would be connected to kind of a sinus headache. So the good news is for all four of those examples that I brought up, we have techniques and tools within our clinic that help address each one of those and for different reasons. Now this is also a very simple way of presenting this information. Understand that these headaches can also be layered. You can also have multiple types of headaches layered in multiple types of dysfunction, not just with the neck, not just with the shoulder, maybe even within the skull and the sinuses themselves. So my take is, and this is why I'm bringing up this presentation to you guys, is I just want you to figure out if you can better pinpoint where you're having your headaches, the pattern they're presenting with, intensity, gives clinicians a lot better idea of how to figure out the root cause of those headaches, and you just end up with a better solution in the end. I think for me as a chiropractor, one of the most frustrating things that I hear is when I'm suspecting a cervicogenic headache and someone's getting a pain medication or a pain pill to address that problem. It's not addressing the problem. It might help how your headache feels, but it's not addressing the underlying problem. So again, I think for chiropractors, headaches are one of the things that we see very regularly and things that we can help with pretty consistently. So if you have any questions about any of this information or you want to see if we can help you, don't hesitate to contact us. Again, my name is Dr. Kyle with Ice Clinics. Thanks for watching.